Hi everyone, I'm back out running some more errands today, but I thought I would go on to the next question that was asked after I did the video on the lung transplants and how I felt about that. Someone asked me how I felt about lung volume reduction surgery, and so I thought this was the perfect chance to go ahead and follow up after the lung transplant to kind of get into what I think about this. And actually, lung volume reduction surgery, I think the idea of it is, the concept is really good, because it gives for the people that are good candidates for it, it gives their lung tissue that's still functioning properly. It gives that that part of the lung the best chance of working how it's supposed to, and usually does drastically improve the quality of life for the people that get it done. On the downside of it, anytime that we cut into the body or go through a drastic surgery like that, it's traumatic for the body, and there's always a huge risk of infection, and how our body may or may not heal from it, and will the surgery even work as it was supposed to. Not everybody's body takes to things the same way as other people, so what might work for one person may not work for another person in almost the exact same situation. So, and then we all heal differently, and then there can be complications, and sometimes that can involve like drainage tubes and collapsed lungs, and there are thousands of different complications that can get into that. So when we're involved in a typical surgery like that, where there is actually opening up of the body and cutting and all that, I just think it opens up the potential for a huge risk. But I do think the idea of it is really good, and this segues right into that Zephyr valve that I was mentioning on the lung transplant video. The Zephyr valve, it's spelled, and I'm not even sure that I'm saying it correctly. I'm probably saying it wrong, just so that we know that I am no expert on how it's pronounced or anything like that. I have done research on it myself into whatever I can find out there on the internet, and I invite you to do your own research as well, just because you may find different stuff than I did. But the Zephyr valve, or Zephyr valve, Zephyr by Pulmonex, and that's Pulmon and then the X at the end. That's the company that makes it and has been doing this, and the Zephyr valve has actually been around for more than 10 years, and it's been used for much longer than 10 years in other countries, and successfully, with a huge success rate. And what it is, it's an endobronchial valve that goes in and blocks the air from getting into the areas of your lungs that do not work properly, and lets whatever air is in them out. So the hyperinflated lungs that you have, it helps fix that problem. So in a way, it's the same as the lung volume reduction surgery, because lung volume reduction gets rid of the hyperinflated portion of your lungs, just leaving the portion that's still working properly. So this Xipher valve gets inserted through your bronchial tube, so there's no surgeries. It's basically like an outpatient procedure. You may stay for them to watch you for a day or two, but some people leave right after it gets done. It slowly lets the air out of the parts of your lungs that aren't working properly, and so the longer that you have it in, the better your lungs work. And so people see a huge difference usually, right after waking up from it, and then it continues to improve things for them in their life, 30 days, 60 days, as they get stronger in their lungs, the part that hasn't been utilized as much because of the hyperinflation, the good part of our lungs that hasn't been used as much starts to get used. It gets stronger and starts functioning properly. And of course, the more you do, the more you can do. And so as your body gets stronger, people that couldn't climb stairs, and there's all kinds of things that come from that. So to me, this is the answer to lung volume reduction surgery. Now, in other countries, this has lasted longer than anything that I've seen done in the U.S. So they've had patients that have had this in for 10 years plus and are still not having any problems with it. And they continue to live a much more normal life than they had prior to it. And in the case that something goes wrong with it, it can be removed. So it's unlike lung volume reduction surgery, where if something goes wrong, there's no turning back. This is different and much less traumatic for your body, much less risk of infection. Just everything about it. I like everything about it because the outcome, the success rate, and the length of time that they've worked in people have been so much longer than all the other things that have been tried. So yeah, I think this is such a good thing. And if you just Google Xipher valve, ZEPHYR, it just got its approval date, June 29th. And I can't help but think that the universe is speaking to me that this is what's right for me, because June 29th is my daughter's birth date, the one that you always see helping me with everything. And just that it got its FDA approval on that date, to me is a sign that it may be the thing for me. So I've been waiting and looking into this for at least 2 years. I'm gonna probably wait probably another year just for the U.S. doctors to get more experience with it, and just become accustomed to working with it, and figuring things out and all that kind of stuff. But yeah, I am super, super excited. This is a huge breakthrough for people with emphysema and COPD, so yeah, it's a huge thing. So I am super excited. And yeah, as far as it goes, is what I think about lung volume reduction surgery. I personally think the idea of it is really good, but I am so happy that the FDA has approved this, because this is a non-barbaric way of doing the lung volume reduction surgery. And to be honest with you, it should have been approved here long ago. They've been doing this in other countries, many other countries, Australia, Germany, England, just many other countries for a long time. So, and the success rate has been so huge that it's actually seems crazy to me that this hasn't been done. So many lives could have been saved and helped with the quality of it had this started 10 years ago when it did, you know, or longer when it did in other countries. So yeah, I am just super excited about this, and I have been waiting. And if you go to if you Google it and go to Pulmonx, they'll actually keep you up to date. If you sign up, just leaving your name and email that you're interested in any information that you can get on it, they will actually send you emails with the hospitals that are already doing it, so you can kind of keep track on how long certain hospitals have been doing it, and you can also find out if there are hospitals in your area doing it. So yeah, it is definitely worth checking out. And this is what I've been waiting for. So yes, that is kind of my thoughts on lung volume reduction surgery and the things that can help. So have a great day, you guys, and hopefully this video helps some more people just like me find their way to a solution. Have a good one. Bye-bye.